Thank you for that lovely introduction, Andrea, and welcome to everyone. It really is an honor and a privilege to be here with you today. Maybe I should just start by explaining a little bit more about why I'm here. Any students in the audience would recognize me from that corner picture. I'm the person that's been in that office down at the bottom of the steps all semester, kind of peeking out, and occasionally people would stop by and ask me directions, which I actually was able to give them on occasion. So I've been delighted to be housed here at Dalhousie University in the School of Nursing in Forest Hall. I came because I am on sabbatical from my position at UW-Madison, and I had some goals during my sabbatical for understanding nursing education better, and nursing education, particularly public health roles in Canada. I wanted to learn more about the public health system in Canada and how nurses are deployed in that system. And I wanted to explore academic partnerships, academic practice and community partnerships more in depth. And finally, I sought to learn more and reflect more about leadership in nursing education. And two colleagues who are in the room have helped me to do that. Janet Bronstein-Moody is a friend from long ago, and we met in our graduate program at the University of Minnesota and have been friends and colleagues since. And Dr. Kathleen McMillan, who is the director of the School of Nursing here at Dalhousie. Those two individuals, bright, clever, wonderful leaders and nurses, have helped me in my journey during this sabbatical, so I want to say a special thank you to both of them. I've also, of course, spent some time here. I've been here since mid-September and have been enjoying very much the experience of living and visiting Nova Scotia and Prince Edward Island. I find your part of the world absolutely beautiful, and I've certainly enjoyed the bit of traveling and lots of walks, and experiencing Atlantic Canada has been a real treat. And so I thank all of you for that, and thank those of you who I've been able to meet with individually who have given me some new insights to take back with me. So let me tell you just a little bit about where I came from, in case you don't know too much about Wisconsin. The University of Wisconsin-Madison is a flagship campus of our university system in Wisconsin. And Wisconsin has about 5.7 million people, so you can see the scale is a little bit different, but not all that different from Nova Scotia. Our university is bigger. We have over 2,000 faculty, and like Dalhousie, we are a major research institution, and in fact, we're the third largest research university in the US. And just so you know, we also like hockey there. So I felt immediate kinship with Canada. The UW-Madison School of Nursing, we have baccalaureate, Doctor of Nursing Practice, and PhD education programs. We have all told about 500 students, and we admit about 165 new baccalaureate students each year. So we actually have a smaller nursing program, I think, than Dalhousie. We have some connections, Canadian connections. Our current dean, Catherine May, was the former dean or director of the University of British Columbia School of Nursing, and is also a former president of the Canadian Association of University Schools of Nursing. And when I go back, one of my key pleasures for the spring semester is going to be cleaning out my office, because we're going to be moving into, for the first time, our own building. The Sidney Scott Cooper Hall is the first separate School of Nursing building on campus. It's actually the fourth building to be named after a woman on our campus, so we're pretty proud of actually having the building, and it's full of all sorts of new educational and research technologies that we're going to be enjoying. So these are my objectives for my talk today. I just kind of want to give a little bit of a high-level overview of academic practice and community linkages, the levels and types and goals of such partnerships. I want to then give a more specific and detailed example of a partnership that I've been involved with in Wisconsin. Then I'd like to do a quick overview of some of the factors that support and hinder these kinds of partnerships. And finally, I'd like to share some thoughts about skills I think we all need for the future of working with academic practice and community partnerships. So the dictionary definition of linkage really points to the state of being united or being linked or tied together. And for me, that's a good image for thinking about partnerships and linkages between academia, practice, and communities. And they're done in order to develop and achieve common purposes, and they're done in ways that have benefits then for all parties involved, all partners involved. We do these kinds of partnerships because we want to achieve certain outcomes. We want to improve practice, we want to improve education for practice, we want to extend and develop the capacity for services, or we really want to improve population health. So those are the outcomes of most of these partnerships, outcomes they desire to get to. But in order to do that, there's also partnerships that can be done at a variety of different levels or the scope. You can have a partnership that's one faculty member and one nurse in practice. You can have a partnership that's a whole school of nursing and a whole Department of Public Health, organization to organization. You can have partnerships that affect a whole system or partnerships that affect a whole community. So depending on what you want your outcomes to be, you may need to have your partnership be at a different level. Of course, that also leads you then to what partners are needed for this partnership to achieve the outcomes that you want to achieve. When I talk about community, what I'm talking about is people who live in communities. I'm talking about organizations, community-based organizations, businesses, government policymakers, religious institutions. Any of those kinds of organizations can be community partners. Academic partners, I'm talking about students, talking about faculty, talking about whole institutions. And practice partners are providers. They might be healthcare providers, they might be nurses, they might be institutions that provide services like a health department or other kinds of organizations. So these are the kinds of people that I refer to when I'm talking about partners. Now, academic partners, be they students, faculty, or institutions as a whole, can bring resources to partnerships like research skills, like the ability to create evidence, the ability to translate evidence to practice. Through the educational enterprise, they can bring opportunities to prepare people to work in practice. Academic institutions can also extend the workforce and enhance practice through the work of faculty and students in practice settings. Practice organizations and providers can inform researchers of practice-relevant research questions. They can provide access to populations and practice expertise. They can guide academics in preparing the future workforce with practice-relevant knowledge and skills. And practice can extend academia, extend teaching through guest lectures, case studies, and working as preceptors. In communities can inform both education and practice. They can inform researchers. They can extend learning opportunities for students into communities. Communities can improve the quality of services, education, and research by providing information, perspective, and access, and asking questions, asking those research questions that are relevant to communities. So in many cases, partnership is not only a better way to do things, but it's really sort of the only way to reach the outcomes that are sought around informing, extending, and improving. So let's go a little bit deeper and look at these types of partnerships. Partnerships between academic institutions or people in academia and community. So there's a couple of examples that I'll just mention, the service learning example and the community-based participatory research example. So service learning is about, it really is about learning. It's about experiential education. Service learning opportunities are developed, implemented, and evaluated in collaboration with the community. Service learning responds to community-identified concerns And in service learning, you need to balance the service aspect that the student is providing to the community with the learning aspect, which is the community is helping the student obtain. So both are important, and one can't sort of outweigh the other. Service learning enhances the curriculum, but service learning is not clinical education. Service learning provides opportunities for students and the people they work with in communities to do some critical reflection about communities and about their coming work as a professional. I'm going to be showing a few different resources that I think are very helpful if you want to go deeper in learning about these different types of partnerships, and particularly if there's any students in the group, these are resources that you might be able to take a look at. The SLICE database was created by the National Service Learning Clearinghouse, which is a US-based resource, and it includes a database that you can search for different levels of service learning, like K through 3 examples or post-secondary examples, as well as locations and types of activities. So that's a great database to explore. There's a great resource in Canada as well. The Canadian Alliance for Community Service Learning is another resource for more information about service learning partnerships and experiences for students. Now, the second one I mentioned was CBPR, or Community-Based Participatory Research. The purpose of this is not service or education, but really is research that focuses on building knowledge and filling the knowledge gaps that are of interest to a community, and then taking action to try to address those gaps. So Community-Based Research Canada is a resource for guidance about conducting partnerships to do community-based participatory research projects. And another good resource is the Community Campus Partnerships for Health. This is based at the University of Washington, and it has a wealth of resources available through its website, including a lot of toolkits and presentations and lots of information that can guide development of actually both service learning and CBD projects. And Community Campus Partnerships for Health also does quite a bit of research about these types of partnerships as well. Okay, so let's move on and look at these types of partnerships between community and practice. Certainly there are partnerships that engage communities in practice settings for the purpose of health improvement across communities or populations. This is the work of public health. And consider activities like coalitions to improve chronic diseases, public health information campaigns like anti-smoking campaigns, policy change efforts, nutrition and physical activity coalitions. Those kinds of things are the work of public health, and they are also community practice kinds of partnerships. Now, many of these, and hopefully more of them, are also including academia. So this is a very good resource for these kinds of partnerships, the Community Toolbox. And this has been in existence since the late 1990s, and it's just been building and getting better and better ever since. It's at the University of Kansas. And it's also a resource for creating and maintaining partnerships designed to improve community or population health. The Canadian Healthy Communities Network is another really good resource for information and tools helpful in promoting and supporting healthy communities initiatives that address chronic disease prevention. And both of those sites have information about developing partnerships and maintaining and supporting those kinds of coalitions. So the last sort of dyad we'll look at is the academic practice partnerships. And there's lots of examples here. So academic practice partnerships may exist to improve education, increase the use of research evidence in practice, maybe to do practice-relevant or practice-based research. They provide opportunities for faculty to practice. These kinds of partnerships might extend the capacity of a practice setting through the deployment of students to do services at that site. and so on. So I'll just talk about a couple of these. I think your progress here at Dow on interprofessional health education is really impressive, and it's far beyond what my own university is doing right now. So I'm going to be looking back to you and watching you for the kinds of experiences you're implementing. The Canadian Interprofessional Health Collaborative website provides a great framework for this and provides resources to use in developing partnerships and conducting interprofessional health education activities. Another resource to look at is, specifically to nursing and nursing education improvement, is the American Association of Colleges of Nursing and the American Organization of Nurse Executives. So a practice organization and an education organization got together to create a set of tools, a process for joint training and leadership, and an award system to recognize schools of nursing and practice settings that are doing exemplar kinds of partnerships. They developed a toolkit directed specifically at schools of nursing and practice settings to talk about how to develop and sustain these kinds of partnerships. I had the privilege of presenting at one of their conferences, and there was a lot of really great conversation around these kinds of partnerships and what the kinds of activities they were doing. In the public health world in the States, there's also something called the Council on Linkages between Academia and Public Health Practice. This is a group of academics and practitioners who created the core competencies for public health practice for the US, and I know Canada has those core competencies as well. This group has done a lot of work on developing those and then disseminating those so that they're used both in academic areas and in practice. This organization, the Public Health Foundation, also supports something called the Academic Health Department Learning Community, and I'm actually a member of this learning community. Anybody can sign up for this, but it's trying to promote the concept of an academic health department along the lines of a teaching hospital or an academic health center. And so there are a group of organizations in the US that are trying to do this and are trying to share information about their efforts to do this through this learning community. Final one I'll mention is the Public Health Practice-Based Research Networks, and this is a newer effort in public health. There have been research networks in primary care for many, many years, both in Canada and in the US and other places as well. Since about 2009, the Robert Wood Johnson Foundation has been funding and supporting efforts in public health to have public health practice-based research network. And I was fortunate to be the co-director of our Wisconsin Public Health Research Network since 2009. And what we're trying to do is put together researchers and public health practitioners to ask and answer questions that are relevant for public health practice. To really focus on public health services and public health systems in ways, using methods and in ways that are already sort of more advanced in the health services realm. So using methods that are often applied to insurance or healthcare services to public health entities. In fact, when I go back to Wisconsin, I'll be beginning a study that I'll be doing in collaboration with this network in Wisconsin to look at shared service arrangements between counties. And this was a question that came out of the practice environment that they wanted more information about. So I wrote a grant in collaboration with them, and we got the money, and so we'll be proceeding to do this research. Okay, so I think in general, I'll just wrap this part up by saying that I'm sure you all have examples of working in partnership, and in one of these kinds of partnerships or multiple ones of these kinds of partnerships. I think we all work in partnerships, and I think that we're going to be doing this more and more and more. And we all need the skills to be able to function well and lead and develop these partnerships. So what I'd like to do now is move to talking about a specific example of an academic practice partnership that I've been involved with and led since about 2005. So we called it LEAP, so Linking Education and Practice for Excellence in Public Health Nursing. So LEAP happened because for a number of years we've had public health nursing conferences, annual conferences, bringing together staff-level public health nurses. And then somewhere along the way we started the night before that conference inviting faculty and nursing managers, supervisors to come together and have dinner before the meeting. And it was through those conversations over several years at dinner that we decided we could do so much more if we worked together, and we could do so much more if we had a few more resources. So the federal government came out with a call for proposals, and I said, okay, I'll write the grant. So I led the effort. I didn't write it all, but I led the effort and put together a team that included practice and faculty from other schools of nursing, and we put a proposal together and we submitted it, and we didn't get it. And then a year later we resubmitted it and we got it the second time around. What we wanted to do was address some of these concerns. We knew that practice was changing for public health nurses in our state. They were moving away from doing a lot of individual services to doing more community-wide kinds of services, and nurses didn't feel like they had the skills to do that. They were concerned about that. We had an aging population of nurses in our state, so we knew there was going to be turnover, and we also knew that our schools of nursing weren't adequately preparing nurses for these new roles that they were likely going to be going into. We also have faculty shortage, and not a lot of faculty with strong public health background. And I had done some surveying with public health nurses and had identified some of the skills that they wanted to develop and some of the concerns that they had about the education system. So we were ready, we were prepared, and had some information to go forward. So if we look at this partnership, this was really designed to improve practice. It was designed to improve preparation for practice, and to a little bit lesser extent, but still there, it was designed to extend services. This was a partnership that was designed to be a system-wide partnership. We included all of the schools of nursing in Wisconsin who provide baccalaureate level nursing education. So that was 18 schools of nursing and 2 online RN to BSN completion programs. And we included all of the local public health departments and tribal health centers. So we have 93 local health departments and 13 tribal health centers, so a total of 100 and some. That's who we were shooting to work with. So our partners were academic partners, students, faculty, and the schools, as well as our practice partners, the local health departments, the tribal health centers. And in the second 3 years, or the second grant, so this was a total of 6 years of funding, we extended into K-12 school nurses, so they were also part of this. So these are our objectives, and I won't read through these. But basically, we wanted to promote collaboration because we knew if we did that, good things would happen. We wanted to promote and support the development of relationships between practice nurses and faculty. We wanted to improve education for practice. We wanted to improve skills for these new challenges that nurses were facing in the practice setting. And we wanted to improve the skills and knowledge of faculty for teaching this content. And also we wanted to work with nurses to help them do a better job of working with students, because we were hearing that some of the nurses didn't feel prepared really to be preceptors. So we had an advisory committee that was made up of both faculty and practice. These are the different target groups of people that we engaged in the process. We had very strong partners with the state public health department, and they had 5 regions. And so each region had a public health nurse consultant. They're all master's prepared nurses, and they were our greatest partners. With the grant, I was able to hire some staff, so had about 3 full-time people in addition to me working on the project, and I certainly wasn't working on it full-time. Over the 6 years, we ended up working with about 1,400 people in some way, shape, or form. Most of them, half of them being public health nurses. We engaged quite a few students, faculty from all 18 schools of nursing and school nurses. We got to 87 of the 93 local health departments and 12 of the 13 tribal health centers. So one of the first things we did, and I think was really important for us to do, was we created a model of public health nursing practice in Wisconsin. And this was this is the graphic representation of that model. I don't expect you to really understand this, and certainly not to read that stuff at the bottom, but what we tried to do was look at what is it that drives public health nursing practice, and what is it that every student of public health nursing should know in our state. And so our practice is driven by our state health plan. So the top part of this is all related to our state health plan. Its goals, its vision, the values, and priorities for that state health plan. The second, in the middle, the pink part there, it refers to our state statutes. So we have state statutes that are both public health oriented and oriented to nursing practice. So those state statutes drive our practice. We have cornerstones, and the cornerstones came out of a project in Minnesota, but they refer to things like social justice. They're the values, the ethics behind our work. The American Nurses Association has scope and standards of practice for public health nursing. That's part of our model. We adopted both the essential public health services model framework of 10 essential public health services, as well as the public health intervention wheel to describe the kinds of interventions that public health nurses in our state do. We applied the nursing process to public health, and we're trying to achieve outcomes that are healthy, safe, and resilient communities, families, and individuals. So that was our model. What we did with this was we pulled all that source information together, and we made it available through an online course that people could take. It was a module in our orientation program. We did a lot of printing of this poster and laminating it and got it out, so that at least during the course of the project, all of the schools were teaching at least this, so it was consistent across all 18 schools, that they could teach other stuff too, but they at least taught this. And these things were included in orientation programs for nurses new to practice. The heart and soul of our project was the regional learning collaboratives. And we divided up our state. We actually had 5 in the grant, but the northern people felt left out, so we added a 6th one during the project. They wanted to be there too. And these were organized around schools of nursing and most of the counties where they might place students. So we had these regional learning collaboratives, and I had about a half-time nurse facilitator for each of these regions. And the real beauty of it was that they were there just to get people together, to help build relationships, to facilitate communication, and then to take forward the ideas that came out of that, take those forward into action. So these are just a few examples of the kinds of things that the RLCs did together. They might do training sessions, other kinds of meetings where they discussed. They did a book club around cultural competency. They did trainings around the intervention wheel. We created toolkits on policy, the policy process, and on financial skills development, so those toolkits. In some cases, they worked on policies that then were shared among all of the regional learning collaboratives, and they tried to implement those. So lots of different activities that were done. The RLCs also focused to a large extent on nursing education and on working with students. One of the activities was the LEAP Spotlight interviews. So this was a student activity where they would do interviews with public health nurses and write those up and take pictures, and then we would put those on our website. So we had about 30 different spotlights like that. They had small scholarships for student projects that were related to the collaboration. One of the enduring things that came out of this was a rural immersion clinical, and that's at the University of Wisconsin. We realized through the conversations that were being had in this northwest corner that there were counties that never had nursing students because they were just too far away to do it on a day basis. And we decided, since if we took if we can take students to Thailand or Uganda, we can surely take them to northern Wisconsin. So for the last several years now, we've had 3-week immersion clinicals in northern Wisconsin, in rural area, 2 rural counties that don't typically get nursing students, and they've had just a wonderful time. It's extended the kinds of service that that health department is able to offer. There have been wonderful examples of the students getting into certain communities where the nurses there just hadn't had time to try to develop those relationships, but the students had time to do that. So we will definitely be continuing that effort. Sometimes there was always challenges that different health departments had students from multiple different schools, and the expectations were always different, and that was very frustrating. So there was quite a bit of work done on kind of standardizing what the expectations were between schools for a field experience, standardizing the kinds of written communication documents that were used between the preceptor and the faculty. So all of those things were done to help improve nursing education. There's also something called the Student Project Database that was created. Jill Collier at the University of Oshkosh did this and created a database, searchable database that was coded by core competency and nursing intervention from the intervention wheel, so that you can go in and search for different kinds of projects that students have actually implemented in health departments. So that was sharing information across health departments about the kinds of things that students can be involved in. Another part of the project was working with those nurses who might be experienced nurses, but they hadn't worked in public health before. And the state health department really wanted an orientation program, so we developed an online orientation program. And we tried it out and we did a study of that. And that orientation program also included a mentoring component, and developed some tools around for both mentors and mentees. And those programs have continued to be available through other resources in our state. We also tried to develop a variety of continuing education materials for practicing nurses. This relates to 2 different sets of very short videos, one about presenting, doing good presentations, presenting data to public groups or to community groups. And then there's a whole series of short videos about things like what's a blog, what's tweeting, what's, what are the social media tools, how do you use Facebook, that kind of thing. And those are continuing to be available as well. And then we created a whole set of actual courses, online courses that you could take for continuing education credit. And these were all targeted to areas that we identified at the beginning that were things that nurses wanted to know more about. The top one, Partnerships for Learning Community Health Nursing, we kind of call it the preceptor course. I had developed that prior to this project as an online course directed to nurses who were working with students in community settings. It's also been adapted to nurses working in acute care settings. So all of these courses were at no cost to nurses during the course of this project. And many of them, some of them are being revised, but many of them are continuing to be available through the continuing education unit at the University of Wisconsin. We also wanted to help our faculty do a better job. So we actually had a series of 5 years of faculty development conferences in January, believe it or not, and we actually had them all. And we invited really great people from around the country to come and just talk with us about how to teach this better. And it really provided a great opportunity for faculty from these different schools to get to know each other. And prior to this project, we really didn't have a way of doing that. So those were good. And then our website became a great resource for everything related to public health nursing and everything related to LEAP. Now we did 3 different studies. Actually, we did more than that, but I'll touch on 3 different studies in relationship to the project, during the project. One was a survey of students. And the aims of this was to understand kind of where students were in terms of their level of interest in a public health career. So this was a very short survey, 3 questions. It was done online. At the end of each semester, we asked faculty to provide the link to this survey to students who had completed their community or public health education part of their program. And so that's who filled it out. And over the 6 semesters that we did this, we have about 800 and almost 900 students filled this out. So this is something we learned, we didn't know this before, that the majority, or the largest percentage of our students get their public health field experience in K-12 schools. And then the second highest percentage was in local health departments. So about 44% get it in schools, and 40% were getting it in local health departments. And you can see a variety of other places where they're assigned for their public health experience. And then this is the responses to the question of what's your interest in public health as a career? And we were kind of pleasantly surprised to see as big a percentage as it was of people who were interested, either moderately or very interested in public health as a career. Almost 46% of the students expressed interest. And then we looked at what factors were associated with higher interest. And we found that the nurses who were in the online RN to BSN completion programs, you don't have that problem here, but we have that problem there. They were much more interested in public health. And in fact, it's required to have a baccalaureate degree to do public health nursing in Wisconsin. So it may have been the very reason why they went back to do this program, might be to get a job in public health. But more interesting is the second one, and that is if they had had their experience in a local health department, they were much more interested in public health as a career. And none of the other, even schools, none of the other sites showed this relationship. It was only the local health department. And then as a kind of more support for that notion, the regional location of the school made a difference. So that the students who were responding from schools in the southeast part of our state were the least interested in public health, and they were also the least likely to have a local health department experience. So we think it does make a difference, and it's supported in other parts of the literature as well, that where students have their clinical placements, if they have a good clinical experience, they're more interested in that field going forward. So I think it behooves us to think about that in terms of the future workforce. The second study we did was we did an assessment of competency at the beginning and then again 4 years later. And we were looking at whether self-assessed competency for population-based public health nursing practice, what it was at the beginning and did it change over time. So we used a tool that was developed by Michelle Izzo and colleagues, and this is what the STEM is and what the responses are. 65 items in these domains. So these are the kinds of things that we're talking about: monitoring community health status, mobilizing partnerships, planning and policy, linking people to service, and so on. And the Cronbach alphas here just show that that's pretty strong scales, both at baseline and follow-up. And these are the results. I could tell you more about the methods if you'd like to hear them. And I'm working on a paper right now about this, but I won't go into those details right now for time. But you can see here in red was the baseline. So in only one domain were they saying that they were competent in doing this, and that was the linking people to services, a very traditional part of what public health nurses might do. And the others were under the midpoint in the range of the scale, which was that I can do this. At time 2, which is in blue, all of those things moved up, and in 4 domains now, it's reached that level, that 3 level of I can do this. And the time 2 survey was done with people who also had done the time 1 and had agreed to be contacted again, so that's the same people. So you might expect it to increase just because of time. So we controlled for the initial time 1 score and looked at it again and found that those who said that they participated in LEAP showed a greater increase in 4 of those areas. That increase was statistically significant. So in all cases, the people who said they participated had higher levels of self-perceived competency than the ones who said that no, they didn't participate. And in 4 cases, as I said, that difference was statistically significant. So we think we did something. The third study we did was we had an external reviewer do 50 interviews with people who had participated in LEAP, half of them in academia and half of them in practice. And these are some of the themes that came out of those qualitative interviews. The perspectives on the project were the same regardless of whether they were in academia or practice. Collaboration was valued, benefits were gained from participation, mutual benefits. Their experience with the project was aligned with what the project was intended to do. They appreciated it. And I think the final one is the most important, that it assisted in shifting their thinking from individual services to community services. And these are, we also did a short survey, actually for another reason, but we had some qualitative responses about the value of LEAP that came out of that as well. So they really appreciated these opportunities to form around projects. They liked the networking and collaboration. So I am comfortable calling on my academic partners now. They liked the professional development activities, providing the opportunity for academia, practicing nurses, and students to learn together and from each other. And I like this one. I believe we have just touched the tip of the iceberg as far as student collaboration is concerned. Both parties reap the reward. The students receive or achieve a meaningful experience in public health that receives the advancement of needed projects and ideas. So LEAP continues, and so sustainability of these is always a huge issue, and I can't say that I'm really proud of the fact that we're not, I don't currently have funding to sustain this, but it is being sustained. One of the regional learning collaboratives is continuing to meet, continuing to do projects together. All of the materials that we develop continue to be available to people, and in fact most of them are on that USB port that I gave to Megan and Andrea, and some of you have. So I think what I learned in this whole process was if you nurture partnerships, they will flourish. And so I think we just need to think about ways of doing that. LEAP's success was due to the great people and partners, great ideas and energy. I think it was helped by its statewide focus so that everybody was doing it. It wasn't just being done in this one little place. It was successful because of the sharing and communication that was supported by the project, by our staff that supported that, the facilitation that they provided. Certainly the resources to provide that facilitation were very important and helpful. But I think bottom line is that we really focused on creating an environment in which those partnerships could happen. And I think that's what made it most successful. And any continued success will be due to that kind of mutual respect and benefits that are gained. Okay, so I really think that partnership is the new norm, and there's a variety of things that we can think about that both hinder and help these kinds of partnerships. So these are things that don't help. People talk about lack of time, lack of resources, lack of communication, nothing surprising there. Certainly we all have competing priorities for time and resources. That affects academia, practice, and communities. Resource limitations certainly affect all three kinds of partners, and operating in silos happens in academia, practice, and communities and can lead to misunderstandings, language problems, ignorance, myths, and mistrust. So we have to do things that address those hindering factors. And when you're doing partnerships with communities, there's an additional kinds of set of barriers, if you will, that stem from power differentials in decision making and funding, sometimes a short-term commitment on the part of academics to those community projects, and lack of attention or emphasis on the community realities and their issues. So these are some things that support these kinds of partnerships. Being intentional, having that mutual respect and trust, investing from both sides, from all partners who invest, those seem to work better. It doesn't have to be money, but it has to be some kind of investment. Sharing knowledge, being transparent about decision making and about knowledge, finding ways so that everybody benefits, and having some formal engagement and leadership, or leadership from the top levels of organizations helps as well. And again, some things that, this came out of a study of community members in academic community partnerships. And what those community members were saying were, articulate things in writing, because then we've got something that we can kind of go back to, using policies and procedures that honor both community members and partners. Sometimes having a person who's from the community be a liaison between the groups can be helpful. Actually recognizing that this takes time on community members' parts, and the researchers who are doing CBPR are being paid because they're the researchers, but the community members aren't always. So look at possibly hiring, compensating them for time and talent. So I think a lot of it goes back to communication, sharing power, sharing decision making, and respect. And all those are important in any partnership. So I'll just close by just saying a couple things about what we need, what professionals, faculty members, students, what we all need to be able to do this kind of work. And again, I think the Canadian framework for interprofessional health education is really great, the interprofessional collaborative practice framework. I've been very impressed by that. And so students require skills to do this kind of interprofessional practice and those competencies that are listed here. Those are about working in partnership with other professionals for providing care to individuals, families, and communities. But I think that also applies to developing and sustaining partnerships. In addition, I think students shouldn't leave campus without knowing how to run a meeting, because they're going to be running meetings, without knowing something about facilitating groups, without knowing something about planning, being able to do a basic logic model about a program, and have some basic understanding of program planning and evaluation, and something about how community coalitions work. So faculty, I think we have the same needs for skills in interprofessional practice, group process and facilitation, program planning, and additionally skills for designing and implementing good service learning and interprofessional health education experiences for students. And if we're researchers who are doing CPPR, obviously you need those skills as well. Practitioners, again, these interprofessional collaborative practice competencies are important: group process, facilitation, program planning, evaluation, and more skills around that coalition development and management is particularly important for people in public health practice. And for leaders, I think in addition we have, wherever the leaders are, we have needs around visioning and strategic planning, being willing and able to set institutional policies and expectations for partnership. If the expectation is there from the top, I think it's more likely to happen. Thinking about resources and how you support partnerships. And then in the academic setting, finding a little better ways than we have right now for rewarding faculty around community engaged scholarship. That this is an important kind of work. I think it's becoming more important and more necessary in order to achieve the outcomes that we want to achieve for population health. And so we need ways of making sure that faculty are rewarded or have incentives for doing that kind of work. So just to conclude, I love this quote: there are two ways of spreading light, to be the candle or the mirror that reflects it. And sometimes we're a candle, sometimes we're a mirror, but together we shine more brightly. And I think that's, together we can bring more resources, time, energy, clever people, brain power, can be brought to bear on the goals, the outcomes that we really need to achieve in terms of health improvement and practice improvement. I think practice benefits, academia benefits, communities benefit, and society benefits when we build relationships based on mutual respect and shared purpose. So unfortunately, I have to go back to snowy Wisconsin, but I wish you all very good fortune in your work and in your partnerships going forward. And again, I thank you.